Hey guys, it's Brad here, paramedic from Mere Supplies. Just want to show you my response bag and what I carry up to my scope of practice. I've put it all in the W1 response bag, and I know in a previous video, Amy's done the one for a FREC-free in the M1 response bag. So there is a few differences. Check out that video, see what you think, and then let us know what you think between the two bags. It's always handy to see. But this is my bag, and it follows a similar sort of pattern to the M1 response bag that you saw in Amy's video a few weeks back. But essentially, you can see that I'm a paramedic here, so it's nicely, easily identifiable. You've got the catastrophic hemorrhage patch there and an airway patch there. It's a wipeable bag. It's got a nice handle to carry the bag, which is a grippy handle, and it can be wiped as well. On the back of the bag, you'll see there is a D-ring here, and that's essentially for hoisting the bag. So if you need to move it from different vehicles or helicopters, whatever it might be. We've got some central straps here. That's just if you're moving sort of longer distances. And we've got a, just like the the M1, sorry, we've got a pouch at the back here. So you can actually unclip these and tuck the straps away. On the front, it follows the W1 response bag in the same way that as you open the front section, you'll see that we've got some basic airway parts, some tourniquets, some trauma bandages. I've got here, as this is my bag, I've got a T-pack in there, which is a chest decompression needle. I've got a Celox vented chest seal and a Celox unvented chest seal. I've also got a Celox applicator and a Celox rapid with a pelvic splint on the bottom. And that basically covers me for any sort of major trauma, airway problems, that quick access panel. Once we've flapped it up, we can then move on to the next patient. So as we get into the bag, you'll notice again, things follow the exact same way that the M1 response bag does. So we've got catastrophic hemorrhage on the top, airway, breathing, circulation, hypothermia, medication, minor injuries and diagnostics. So here we've got the catastrophic hemorrhage pouch. I'll pull that out. It's really easy to remove. It's Velcro backed. Once you get into the pouch, we've got a SWAT tourniquet. Now these are really great on small limbs and for so for children and animals, it's recommended for those because not always the cat tourniquet is going to fit because of the plastic it's got on the bottom. Further into the pouch, we've got a fracture splint. We've got the blast bandage. We have the Elias 6-inch bandage as well. So there's a variety of bandages in the kit. As I say, you've seen on the front the quick access panel. We've got 2 emergency bandages. And here we've got some bit more specialized bandages, and that just allows greater versatility when coming to treat the patient. So that's the catastrophic hemorrhage pouch. As we move further into the bag, you'll see we've got the green airway pouch. Now in here, I just carry some McGill's forceps, adult and child. I've got a suction-like device. This is a really good device to carry. It's lightweight, it's cost-effective, and it can get you out of a bit of a sticky situation if that airway is blocked. I've got some advanced airways, so this is the eye gels we've got here. I've got a 3 and a size 4. Now that allows you to essentially climb up your airway ladder. As you see, on the front we've got some nasos, and on the other side we've got some oral pharyngeal airways as well. So we've got our basic airways, and now we've stepped it up to our more advanced airways, as you can see here. In that as well, I've got 2 different size laryngoscopes. So I've got a Mach 2 blade and a Mach 3 blade. I've had it before where I've been to see a patient and unfortunately they've had some airway problems. For me on this occasion, I had a quick look with the laryngoscope and found that there was actually a lot of dry tissue stuffed to the back of the patient's throat. Now, if I hadn't have done that and I hadn't have a quick look, I possibly would have caused greater airway problem because I'd have pushed the eye gel in and jammed the tissue down there further. So fortunately, having a laryngoscope and some McGill's, I was able to pick that tissue out, enabling me to provide adequate oxygenation to the patient. We've also got some lube. Now lube's great, is great for your eye gels and your nasos. So we keep 1 in here and 3 on the front. So that's the airway pouch that we've got in the response bag. Now, just a quick note on the bag, you'll start to see some straps forming here. And what we've done with this bag is enabled you to essentially rejig your pouches so that you could put an O2 cylinder in there. So your O2 cylinder, which will fit a standard CD bottle, can sit centrally, so it's nice and comfortable for the back. And then you just basically rejig your pouches to fit in the bag. So everything will still fit, but you've just got to rejig and put the O2 cylinder in the middle. As we move on, we've got the breathing pouch. As we get into the pouch, we'll see we've got a flexible catheter mount, and so that will attach to your eye gel. We have a filter here, so it's a bacterial and viral filter. Essentially, any nasties that the patient's breathing out will get caught into the filter, and so minimizing the risk of cross-contamination. I've got a Thomas tube holder as well. Now, these are quite versatile. You can use them with an eye gel and with an ET tube. I've found them to be good. I know a lot of people say they're not that great, but I've never had a problem personally, so we put one in there. We've also got the pocket BVM. A lot of people ask about the pocket BVM because it's quite expensive really when you compare it with other BVMs out there. It's for good reason. It's light, it's compact, and when you get into there, it functions just the same as a normal BVM, and you can see how compressed that it really is. So you've got your mask here. Once you open the BVM out, you can nicely ventilate your patient, but you've also got a little bit of tubing here. Now, if you've got an adult O2 mask, what you can do is take the tubing off, connect it to here, and then connect that to your cylinder. So you can actually provide oxygen with this, and also you've got a reservoir bag at the back. I've also, with my bag, got a couple of ET tubes, a few different sizes. I've had it before where I have used an eye gel, and unfortunately, people don't tend to have cardiac arrests in the best places, and some of those can be just after food or in a restaurant or wherever. And essentially, when you begin to ventilate the patient, what you can do is end up with fluid and bits of food coming out. And so what that can do is block the airway. So I've got some ET tubes in mine, just so that I could step it up one more time and really secure that airway if I needed to. So that's the breathing pouch that we've got in the bag. Now, lastly of the top section, you might just be able to see it here, is the circulation kit. The circulation kit has got what you need to be able to gain IV or IO access in this case. So I'll show you what's in my bag. So I've got a couple of syringes, I've got a variety of different cannula sizes, got 5 needles, different sizes, so obviously this allows me to have a little bit of versatility there. I've got a 50ml syringe. Now they're really handy with certain medications, stuff like glucose. It's nice to be able to draw it up in a larger syringe, so it's a nice to have. There's more syringes in there as well. I've also got an IO gun. Now I keep mine in a little lock-sack bag. Now we all know IO guns are not the most cheapest of things in the world, and so I keep mine protected in this waterproof case, which is a lock-sack bag. I've also got a range of size of IO needles. So here we have a 25ml one, and we've got a 15 and a 45. So there's a range of sizes in there from adults to peds. I've got an Ambex IV starter kit, and that allows me to connect a IV to somebody quite nicely. So guys, that's your cannulation kit. So now we're done with the top section of the bag, we move to the bottom section, and here we've got the medication pouch. Now, as we get into that pouch, I've just got a IV infusion set and just some sodium chloride. Now I'm a paramedic, so I can carry that sort of kit. Make sure you're not acting out of your scope of practice and that you're carrying the correct equipment for your skill set. That's the medication pouch that we have in the bag. Moving to the side, we have the hypothermia pouch. In here, I've just got a blizzard blanket. Now it is a green 3-layer blizzard blanket. Moving on, we've got the diagnostic section. Now the diagnostic section, we've made this pouch really quite big, and in a lot of bags, they're really quite small. The reason we've made it big is because finding out what's wrong with your patient is just as good as being able to provide the treatment for them. And so having the correct tools really helps you along that treatment process. So on top of the pouch, straight away, I've got my stethoscope. I've got a Lumica light stick. I've got some shears. I've got a battery in here. Now I'll show you, we have got a defibrillator in this diagnostic section, but that's a spare battery for it. I've got a little notepad. You never know when you'll need to write down some just basic notes or things that are crossing your mind, so it's always handy to have one in there. I've got a Braun thermometer. I've got a manual blood pressure cuff. I've got a BM machine which measures the glucose levels within a patient's blood. I've got a pulse oximeter, tiny little pulse oximeter here. We've also got our pupil pen light, which comes with some different sizes here. Lastly, guys, we have the Schiller EasyPort Plus defibrillator. Now it does sing to the tune of about £2,500, so it's not the cheapest of defibrillators out there, but it is for good reason. It comes with a nice display here. Now when you turn it on, it will show you the wave that the patient's in. So for me as a paramedic, it's quite handy to see if the patient's in VF or VT or asystole. Obviously it's not going to shock asystole, but it's handy to see to kind of get an idea where is the treatment going with the patient. So it also allows you to plug in the device so that you can record the data and have that on a computer and be able to print it off or do whatever. But it also has an additional puck monitor which measures the depth and rate in which you're providing those compressions. That can be really helpful, especially when working with a bystander that's not used to it, or if you've been doing CPR for a long time. So that's my diagnostics pouch. And lastly, we've got the minor injuries pouch. This is the pouch you're going to be using the most. It's certainly the one I use the most. Plasters, as you see, they're already opened. Medium dressing here. I've got a large dressing, an iPad, a conforming bandage, some wipes, some skin closure strips, and some burns gel and some eye wash. Now, you can get carried away with minor injuries things. There's all sorts out there, different pads, different types of pads, different tapes, and all sorts of things. That is the W1 response bag kitted out to my spec as a paramedic. Let us know what you think of the bag. Let us know what you think of the content. We're always eager to change things. Maybe there's new technologies out there, so we can include that on the store so that we can all provide better healthcare to the patients in which we serve.